second reading, and we'll just say as amended.
But it's always done, it's never
Correct.
Billy or something. Yeah. See that?
Well, I want to get requests from
Mayor?
people in our community who wanted to address some things that are going on, so. I'll
Good
see
evening,
you soon.
everyone.
Okay, sure.
Welcome to our special meeting on this date, June 22nd. We have one item on the agenda tonight, and that is to amend, the intention at least is to amend Ordinance 4565, which is our return to work ordinance. Last Monday, the City Council asked us to review and revise our return to work ordinance. You collectively gave us a number of items to focus on, which we did this past week. We also obtained some suggestions with our local COVID. That COVID team meets weekly, consists of representatives from the Phelps County Health Department, Phelps Health, the Health Director for MS&T, Chief Smith from our Fire Department, and John Nye. We often use them as a collective sounding board. We're submitting to you tonight a revised ordinance based on what we think you wanted to at least head a particular direction on. Our previous ordinances were based on suggested guidelines from the governor and the CDC. However, the guidelines were actually integrated as enforceable requirements. That is what previous ordinances effectively did. The ordinance before you tonight removes most of those requirements and returns those to enforceable guidelines. In essence, this ordinance relies on individual rights, decisions, and responsibilities. The virus is not going away anytime soon, and our area has yet to experience its arrival. For the good of all, we ask every citizen to be sensible and cautious, regardless of what that ordinance is going to look like at the end of this evening. We have in your packet a redlined version of the ordinance, so you can see the changes. But at Jody's suggestion, I think it was a very good one, John prepared a short summary, but it's the talking points to really just go through succinctly and highlight all those changes. So, with that done.
Thank you, Mayor. And it was helpful to go back and sort of look at what the differences were. We didn't think there were significant changes in there, but I think in some ways we get a little too close to these documents and realize that the public doesn't always have the benefit of going back and knowing that history. So I want to take just a minute to talk about the history of the ordinances, of the actions the City Council has taken, and then we can talk about some of the differences between this ordinance, the one that you adopted just a couple of weeks ago. So Rolla's stay-at-home ordinance was first enacted on March 30th. That's the one that we submitted to you as a first reading, and council felt it was important to declare it as an emergency and had it in place, and so that expired on May 11th. And that was the tough one because we clearly identified who were essential and non-essential businesses. Our first return to work ordinance was enacted on May 4th. I think there's a little misunderstanding about that. Rolla has been fully back to work from all employers' positions since May 4th. We did have limitations and restrictions on there. With this, let's open up Rolla. We have been opened up from a business standpoint, just with some restrictions on it. Nevertheless, those restrictions can be a real impact on some small businesses in particular. Some of the exceptions or requirements at that time were 6 foot social distancing, either a 10% or a 25% occupancy limitation based on the size of the building. That was right out of the governor's orders at the time. Mask for personal care attendance, and that kind of thing. Rolla's second return to work ordinance was enacted on June 1st, and that was the one that expired. It was set to expire on July 7th. The answer, why July 7th? It was 2 meetings from the enactment of the ordinance. To come back every 2 weeks with an ordinance and expect council to do a first and final reading, it's just a challenge for everyone to prepare for you, and so that's the way we've been staging a lot of these to cover a 2-week time period. That second return to work ordinance also called for masks for personal care attendance, but it did require a written and approved health and safety plan. And I really want to call this part out. This is really where that requirement fell in. It's when it was being done on public property, city property, public property, or when police and fire or other public work services were being called to assist. So a group that was having a church or another group that was having a big event on their own property, not requiring or requesting public services, weren't required to submit a health and safety plan. is only on public property or when our manpower resources were being called in to support that other effort. On June 15th, council voted not to repeal that ordinance entirely. I think it was an 8-4 vote, and that's where we came up with at least some suggestions on some tweaking of this latest version. And so I'm going to run through those, and believe me, every one of these you could question, challenge, change the dates, alternate. It's really there as a document for you to start with, and we can make the adjustments as we need to tonight. So the one that we have before us tonight, you call it Return to Work Ordinance Phase 3. Continues this idea of gradually leasing or opening things up more with less restrictions. We changed the dates, and Ann Murphy did catch us on the ordinance date. We listed June 22nd, and it should be June 23rd, so we'll make that correction as well. It does extend this date until July 21st, which gets us to 2 meetings. Council wants to revisit this in 2 weeks. We can certainly roll that date back, but that's why we have July 21st in there. We also extended the emergency declaration until September 30th. Otherwise, it would expire on July 7th. The governor has extended the state's emergency declaration to the end of the year, partly because you can take advantage of the various CARE Act funding and other programs that are out there as long as the state decides to be declared an emergency.
Why, John, excuse me.
Yeah.
Why are we extending ours to September 30th? Or why are you suggesting that?
Get through the opening of school.
Okay.
College is going to be back second, third week of August. That gives us a couple of weeks after that. We could say September 1, but if the idea, the next hurdle, I think, is that 7,000 students coming back and what impact. And it doesn't, again, we can change all that. That was the logic of it.
Okay, thank you.
And John, could you, I got asked by one of the individuals on our board, what does that say? Could you specify that again? The Declaration of State of Emergency, what does that mean? They wanted to declare on that.
Well, Missouri's, the governors declared that until the end of the year.
Yeah.
We extended ours till September 30th because it gives us our own authority to implement changes, things like whether we want to do Zoom meetings, whether we want to delegate the authority mayor to be able to open or close up some of our facilities if numbers happen to increase. That's an authorization legislatively the council has given. So that's the idea of that.
Thank you.
So what are we trying to do? The intent of this is to continue to protect the most vulnerable populations and anticipates the 7,000 or so college students returning to campus. And I'll tell you, you'll hear that number's actually 8,000 or slightly higher. But of course, a number of those students are already living in Rolla, Phelps County, and so this anticipates folks who are coming from outside the Phelps County area. The ordinance as it's proposed tonight eliminates the limit of 10. It actually doesn't give a limit at all. If you have a group of 20 family members or your softball team wants to go to a restaurant, you're able to do that as long as within that area there is spacing between that group and another group. So we've eliminated the restriction on the number of people in a party. We still are maintaining a 6-foot spacing between tables. There's been some discussion about can we roll that back. Council certainly can do that. The CDC guideline is still at 6 foot. I was trying to think, what would be the standard distance between tables in a restaurant? 6 foot's my wingspan. You think of people sitting in chairs at those tables, it's probably 4, 5, 6 foot, almost anyway. But that 6 foot is just a number that the CDC has been pushing, and we've kept that in our ordinance. We're allowing limited bar seating. That's been an issue that we've heard from 4 or 5 of our businesses that were really impacted, and so this would allow groupings to be at the bar. But if you have a private group of 2 or 3 or 4 people or one individual, then the next stranger group of people would be 6 feet apart from that group. Really a distinction that has been pretty significant here is it's the whole idea of the food bars, smorgasbord. So think of those, Sterling Stockade, for instance, which clearly operates a lot of there. Some of the Chinese establishments. That's really important. In all of our gas station convenience stores, we're doing some degree of quick self-serve kind of food. Previous ordinance didn't allow that at all unless there was a personal care attendant serving. This ordinance releases that obligation and says that they either have to provide a dedicated person to serve or you have disposable serving utensils. So they're really required to have sneeze guards and that protection, but you're not going to be able to have multiple people sort of scooping out of that dish using the same utensils. So if that's a disposable utensil, those establishments can reopen their food service. There was some talk at the council meeting about trying to open up the occupancy in lobbies, and we could have thought about maybe giving based on the size of the facility, but we weren't sure how to do that because every doctor's office and dental practice and hairstylist has a different need and format, so we're just suggesting as long as you can maintain 6 feet between family groupings in that space, that there is no limit on occupancy. It's all got space to accommodate that. We eliminated occupancy altogether. So our previous couple of ordinances and the governors had the 10% and 25% rule, and that affected everything from the Walmarts all the way down to the smallest mom and pop store. We've removed that provision from the ordinance entirely. That was a real challenge for the fire department and our inspectors to go out and be educating, monitoring. Although this weekend I went into a couple stores and they were all sitting there at their front counters doing an enter and exit count. This would eliminate all of that restriction as long as they can reasonably maintain that 6-foot spacing. And we added the word reasonably maintained because we know people walking back and forth on aisles that you're not maintaining 6-foot spacing, but it's a fleeting passing as opposed to an ability to sort of congregate or conduct some business or activity in close proximity. We are still requiring personal care attendants and servers to wear masks. That was only kind of debated last week. That's an issue we're hearing about. It seems like, and I asked servers when I encountered them, if they're getting used to the crazy masks, and none of them like them, but they are getting used to them. I think if you gave them the option, you'd find some businesses that would choose not to do that. You'd find others that feel that that was an important message to send to their customer base. But we're proposing that those folks, because they're going to be in close proximity for more than just a passing moment, they would still be required to wear a mask. Because our previous ordinance said very little on nursing home and in-home care attendants, because the governor's order was pretty comprehensive on that, prohibited it, that's all been rescinded now, and the state is actually looking at guidelines to give them more direction. So we did add some language in our ordinance for both home visitation interaction as well as nursing home care. But it really just says that they've got to follow the DHSS guidelines when those get rolled out. Our ordinance, as we have really since May, permits all social activities provided they comply with CDC guidelines. So big events, church events, those have all been able to operate since May. We took out the 6-foot reference and specificity to that, but saying we're still following CDC guidelines, and that guideline still says 6 foot. So leave it to you whether you want to keep that 6 foot in or just leave the CDC guidelines in case CDC modifies that over time. We're still requiring a written health and safety plan for special events on public property or private property if they are requesting the assistance of our public works, our public safety services. And this didn't surface, but I kept hearing it on Facebook, this notion that we arrested for these things. And I can tell you that was never the intent of city council in doing this. A misdemeanor in Missouri allows for up to $500 fine and 90 days in jail. Virtually never happens. In this case, we never envisioned that. If we had to, we were prepared to issue a citation, that would go on a report and a fine assessed. But I'm suggesting that we remove the entire provision for jail time for these violations of the specific order here. So those are the highlights to the ordinance. I'll just give you a quick update on the positive cases that we've had in the community. I just got this from Ash this afternoon. I think you're all aware this spread pretty quickly over the weekend. Phelps County is up to 10 positive cases. That was 0 in March, 2 in April, 2 in May. We have 6 in June, and we're 2/3 of the month through. There has been 1 hospitalization in Phelps and 1 hospitalization from the Marys County resident at Phelps Health Hospital. We aren't seeing this as some dramatic spike. We don't think this is necessarily a reaction to anything we've done on our ordinances, but those numbers are ticking up in Missouri, and they're ticking up in certain areas of Missouri in particular. So that's the latest information. There were a couple more positives, and we haven't had conclusive results on the last 2 that are outstanding for those. So I'd be able to answer questions or pass this back over to the mayor to field any motions you would like to consider.
I just want a quick point of clarification so that I'm understanding correctly. The 6-foot distance, for example, if you were to go into a restaurant, the restaurants are currently being assessed by our public safety officials in terms of actually having their tables at 6-foot distance. Is that correct?
Correct.
Okay, if you were to go into a church, is there anything doing the same for keeping people from 6 feet from each other, other than say, hey, follow the guidelines? Is there any enforcement, or is there any understanding within the churches that people are supposed to be staying 6 foot away in the pews, and is there enforcement of that in any way?
So in the current ordinance, or the previous one that we have that's still in effect, it was 6 foot spacing for any large-scale event, including churches and restaurants. This one is proposed because we're sort of beginning to lax some of these rules. We're suggesting that churches or other large gatherings, all of whom have a responsibility to the safety of their members or their constituents, we're saying you would not be in violation and subject to a fine. And the struggle would be, we're not really sure how we'd go into a church or another big event and hold someone responsible for that. The thought is, on a business or a place like a restaurant or a bar, there's a profit motive, and so you're trying to balance that. We're trying to make a dollar versus, health and safety considerations. And we're saying that that business owner is making a financial decision. It's how they laid out the facility, and we're still suggesting that 6 foot spacing still be in there in that circumstance. I get the picture that there's not a 6 foot consistent to get on every location out there, but that was the rationale we used. Again, this idea of gradual reopening, a little more flexibility on the churches, because we really can't hold somebody individually. We're going to go to the individual. And even in our ordinance, the restaurant that violated that wouldn't be the customer that would be cited, it would be the business owner that would be cited.
Okay. Was there ever any inspection of church, was there ever any enforcement of the churches before when they did start opening? Or was
No.
it was always just, please do 6 foot?
Yeah. Now, we were hearing from the churches, like, from the first time we passed an ordinance and said we were shutting everything down except for essential businesses. Churches have been really monitoring and then asking, what can we do safely? And so Ron has done inspections, the health department's done lots of inspections, so they have really been on kind of the cutting edge of adopting their own restrictions and regulations. And I can't say that that's universal for every church in Rolla, but for every church that I'm familiar with or have friends that have gone, their churches are being ultra conservative because they tend to have a more vulnerable population, a little older. They've been approaching it very, very conservatively.
Right.
But you're right, there's not been a spot check inspection on those kinds of things.
So the only reason I wanted to bring it up, because obviously we have had one of the folks that spoke last time was a small business restaurant owner. I've had discussions with him a little more, and I know that some of the other small businesses in general, they're concerned about being able to keep their business and their livelihood going, and I understand that, and I want to be able to try to balance, which is exactly what you all are doing, and everybody here is trying to do, balance safety and livelihood with everybody. And I only bring it up because I'd hate to have a situation where they feel, one group or another feels like they're having to be held to a higher standard than another. And the reason I also bring it up is because I do feel like certain gatherings, ones with more people, have certainly a higher ability to spread, just because it can hit 300 people at once as opposed to a place that has 50 people in it or whatever. So it's just something I've had going through my head, and I wanted to clarify a little more. But to be clear, you could have 400 or 500. That's the max capacity of a church. You could have all that many people in there. They could be singing. They could be doing the normal church activities.
Well, I mean, they're still required to follow the CDC guidelines, which is still 6 feet, but there's not a enforcement mechanism
Okay.
that would cite for failing to do
Okay, thank you.
John,
that. Yes. Yes.
you say Ann?
Yeah, but you're on mute, it looks like.
No, you're not now.
Oh, no, you're good.
No, I'm good, right? I'm good? Yeah. I had a couple phone calls from constituents concerned about the exposure that would be allowed at food bars if people were allowed to serve themselves, okay? And I also talked to a general manager at Sirloin Stockade and got his view of it. Right now he has people serving, but it's at a great cost to him, and it's not really satisfactory for his customers either. but it's something that they've been doing. Is his business? He said about 95% of his customers don't wear a mask when they come in. So he does provide sanitizer and gloves for people, but that's at their discretion. I was wondering, I was trying to find out what the Phelps County Health Department guidelines were for self-service in food bars. And you mentioned that we coordinated with them. Could you explain a little bit more? I mean, and because I haven't seen, as food transmission of COVID. I think if the temperatures are maintained, I think we're pretty safe. But it's that contamination from touching utensils that concern people also.
Yeah, so actually, it was interesting. Actually, one from the health department was actually a proponent of giving more flexibility to the smorgasbord and the seltzer items. Her point is that those facilities really have very good health and safety protocols already in their systems. They're very well trained, they're inspected regularly. So she was actually suggesting that we would consider loosening that up. And so that's why we've added that language. As long as they use disposable utensils, they would not be required to pay to have someone actually serving or dishing out those areas. Maybe another way to go, and this would really be a question that we would have to ask Ashley or have her work this out with those restaurants, is if they had the ability to change gloves every time somebody went up there. Rather than throwing away utensils, they were required to put a glove in order to access that utensil. Does that somehow become more safe than a disposable utensil? I don't have a good answer for that.
Right.
Ashley was pretty confident that the health department could work with those food establishments, give them more flexibility, and still do it very safely. And this ordinance adds some of that flexibility to it.
Okay. Yeah. Okay. Well, that's good. Yeah, he mentions that they do change out their utensils every hour, and there's a number of things that they've taken into consideration. But I was just curious. Okay, well, I'm glad that she had that input. That's good. Okay.
The limitations, the 6-foot limitation, I have talked to so many people that are just flat against that period. It's just too much. They have suggested to me 3 to 4 feet. I'm going to suggest 4 feet simply because a lot of these, as you said, lobby areas or entry areas don't even have 6 feet long, or they'd have 1 or 2 people in there, that would be it. But not only that, like at a bar, if you have one group of people and then you have to have 6 foot before the next, there's no space left in a lot of them. Same with the restaurants. 4 feet, I think, would be plenty sufficient. I mean, we're still being proactive. We're still trying to save people, if you will. But everybody's going to do what they're going to do themselves as individuals. They're not stupid. If they want to wear a mask, they're going to. If they don't want to visit these places, don't. But these businesses are hurting. And it's wrong of us to tell them that they can't survive.
I mean, I don't know that I've heard anybody dropping a 6-foot distancing with all the suggested guidelines at 6 foot. We'd be better off just simply saying we're going to repeal and just go everything off the guidelines that the state has already sort of established as the minimum. But it just seems to me it would be really unusual to have a 4-foot spacing between seats when CDC and everybody else is still recommending 6 foot. But council has the right to do that.
Then just drop it all.
And that's
No
council's
distance.
fault. John?
I think our main concern is the smaller restaurants, small dining rooms, and I'm thinking Sydney's, Waffle House, Saltwater, American Taco, I'm sure I'm leaving some off, that just don't have very much space. And if you eliminate 2 or 3 or 4 of their tables, with the 6-foot rule, it's going to affect their margins. And I suggested today in an email to all of you that we think about doing something like any restaurant with less than 50 seats or 40 seats, something like that. We just don't include them in the ordinance. We give them a pass, so they can continue to operate. Even if it's full capacity for them, or if they've got a lot of booths, things like that. Oh, I was thinking of Public House is another one. So
Yeah, it's for that, so.
they just don't, it's not a very big facility.
Well, let me turn that back over to the mayor, and he can entertain the, I'm sorry, you had a question?
Yes, sorry. To the point about small businesses surviving this, we all want them to. How are the funds being dispersed from the county commissioner? I understand they're working with a lawyer and that small businesses that are struggling can seek out funds, and there's supposed to be like $5.2 million of funds that can be dispersed?
Yeah, so there was $5.2 million that Phelps County received. At this point, Phelps County is only taking applications for public entities or not-for-profits. And they've contracted with the Merrimack Regional Planning Commission to administer that. At this point, I don't think they've really figured out what they're going to do with private businesses or private individuals to apply. Every county is addressing that differently. Some have made it available for private entities, some have used it just for public purposes and needs. Things like testing at S&T students or additional resources for the hospital.
But this is something that we could look at doing for small businesses, correct?
Well, the city can't. The money goes
Yeah,
to the county.
but-
The county could use a portion of those funds as a small loan program for small businesses. They just haven't decided to do that at this point. And those dollars will be available through 2020, which is one of the reasons, again, the governor extended this declaration. So counties figure that out, and figure what their public purpose needs were, and then if dollars available for private, there's still time to reimburse or apply for those funds. But at this point, we don't have any indication from county what they're going to do with the balance of those dollars.
So we should encourage residents then to get in touch with the county commissioners as well.
So,
Okay, thank you.
so back over to you, Mayor.
I'd be a little surprised if the county acted like this institution, to be honest with you, but the Payroll Protection Act, I was amazed about how many dollars flowed to the community for small businesses. It's in millions and many millions of dollars. And I'm boggling to see how much payroll is actually in the community. So we've gone from restrictions to virtually no restrictions, mostly just guidelines. So we need to look direction from how you want to proceed. We could make 6 foot, 4 foot. Frankly, I'm not so sure anybody's going to follow either. So the question is, do we even want an ordinance?
On restaurant spacing or the whole thing?
Whole thing.
Because I brought this up.
I mean, you have guidelines, John, right?
Right.
Mostly guidelines. And I think I've come full circle in the last couple of months. I think people are gonna do what the damn well want to do. So I'm asking the question, do you want an ordinance?
I don't.
I don't.
I'm asking that question philosophically first, before we get into nuances of 6 foot, 5 foot, mast here, mast not there, change out the utensil here. Those are academic. The question fundamentally is, do you want an ordinance? So let's start with
Mr. Mayor,
I know.
I just want to make one point of order type. I think if you elect to go without an ordinance, rather than say we are repealing the ordinance. Oh, sorry.
Just a quick reminder, they're having a hard time hearing. Fine wearing the mask. But you need to be right on the mic when you're going to speak. It's not going to be picked up at home on Zoom.
So that's like the first time anybody's ever said that they've had trouble hearing me. If, instead of saying that we're going to repeal the entire ordinance, my recommendation would be that you would consider doing all of the ordinance as a recommendation rather than just eliminating the ordinance. It would effectively have the same impact, but that way it will be the easiest way to do that tonight is to make them simply recommendations rather than repeal 45, 65, because while I can do that, basically it's going to look like a document that says we repealed 45, 65, and that's essentially all it'll say. I mean, just, I don't know whether that changes the way you're looking at it or not. I'm just trying to make sure as you move forward that you have an idea of what the practice will look like, trying to do an ordinance tonight. Because obviously I can't type up another one.
That's all a little confusing.
What I was suggesting was, we have almost all recommendations. To eliminate the ordinance, I'm not going to recommend that you do that. There are things in there that are essential.
Drop the restrictions.
Drop the restrictions rather than just eliminate the ordinance.
I understood that.
The emergency declaration is important to keep.
Okay, got it.
I could get behind that.
I just wanted to follow up that, on what John mentioned. I've gotten a lot of input from folks, and I can say that the majority of input I've gotten, emails, calls, conversations, this week has actually been the opposite of what I thought it was going to be. I thought people were going to be saying open everything up, but I think people are looking at the numbers in Missouri and around the nation, but certainly Missouri, and it does seem like we're starting to get more numbers. So I just want to bring that up as one thing that I've had a lot of feedback, and if I'm going to listen to the feedback I've been getting, it's definitely be cautious for the safety of our citizens. So I just want to say that. But the other thing I wanted to mention with what John had said, I'm also in agreement that if there's something, I do think the largest events that happen are the ones that are potential to be the most spreading of the virus. And so our small businesses kind of suffer with whether it's the 6 foot or the 25% reduction, they suffered with that for a while. And certain places, like John had mentioned, the 6 foot really puts them at the same place they were with 25%. They don't have the space to do more. And these are places that really have like a rush at lunch and a rush at dinner. And we basically say nobody can be in your location to do any business. So I want to lean towards safety, but I do also want to try to see if there's something we can do for our small restaurant businesses. And I kind of agree that maybe there's a number we can come up with, because, hey, it's not going to be if something does happen and if somebody with COVID shows up at one of these places, there's a small number of people total in the whole restaurant that can be exposed at that time. So I think if we had a number, 30, 40, 30, whatever it is. But one thing I did want to just
Let me correct you one thing. The effect of somebody that's infected could last. If they're not using disposable
That's true.
menus and things like that, they're coughing on the table, coughing on the.
or touch the door on the way in, everybody touching the door coming in. Right.
Yeah, so just.
Totally agree. But obviously having 500 people in a room and all interacting, and whether that's singing or any kind of gathering, is certainly, to me, seems like a higher potential. But I don't disagree. There's lots of ways this thing can spread. So thank you for the clarification. One thing I wanted to clarify and ask was twofold on that. One way our businesses could try to help themselves on that is putting up barriers. Is that correct that I read in there that if you don't have the spacing but you could put up a barrier, or you could put tables outside? So maybe there's a number we could come up with. Like right now, it sounds like Ron, who I talked with at the taco company, he's at like 10 or 12 total seats with a 6 foot distance. And he can't go any more than that unless he puts up barriers, expands his shop, or puts some outside, which I think it's maybe good that he could consider those. But I think if we could come up with a number so that he and other folks that are in that situation could have a minimum ability to say, hey, 25 or whatever it is, that at least they know they can have that many people in. I think that maybe that's throwing a bone to them and trying to help them a bit. And the last thing I just wanted to say is that we had a number of citizen comments at the last meeting, and I noticed that none of those citizen comments at the last meeting brought up the fact that we have a very low case count that actually we're starting to see rise, so we should keep an eye on that. But we've had a very low case count in our county compared to others, and we have to at least consider that it could be we can't say that it is for sure, but it could be related to the careful way in which we have proceeded during the time of the pandemic. So those are just some things I wanted to bring up, and appreciate you letting me
So
mention
one
them.
thing I heard is, and we're going to get through here, we're going to circle back to this issue on distancing in small locations. Terry? Anything?
I'm sorry.
Mayor, one of the things that I was hoping we would see, if we were going to keep an ordinance in place or not, or if we were to amend the ordinance, is to have certain benchmarks, that if the benchmarks were met, we wouldn't necessarily need to keep coming back and having these emergency meetings. I didn't see that in here. Is there a reason?
It's a real good reasons, Matt. It's easier said than done. You talk about getting a consensus on these issues, 6 foot, 5 foot mask or no mask. Do you know the challenge we're having getting a consensus on this? We broached it with the COVID team last week, enough to stimulate a conversation and for the group to think about it. And we will bring you those recommendations within 2 weeks from this one. But if I was a betting man, I'd say that that's going to be a contentious issue. I'll just give you an example. Is it 3 people in the hospital? Is it 2 deaths? Is it 10 COVID cases or is it 50 COVID cases? I don't have the answer to that, but I bet $1 it'll be 12 different answers.
No, I think you're right. I mean, I think it is difficult to decide, but then again, at some point, we have to be able to.
We want to come back to you at an appropriate time and say, okay, it's time to look at it. But I don't have those numbers yet. I mean, John, do you think the group within 2 weeks?
We're going to need at least 2 more conversations on it.
Yeah.
Hopefully have consensus.
Hopefully.
We're scratching the surface now.
And that's 5 people getting consensus, that's not 12 people getting consensus.
Yeah, one of the challenges was that even if we talked about a number, let's just say 10, if we had 10 positive active cases with 2 hospitalizations, that was kind of a couple of numbers we were zeroing in on. The problem was, if those 10 are random, that's a different reaction than if all 10 of them popped up at a Walmart, or if they popped up at one manufacturing facility. So we started then saying, okay, it's this number if, it's this scenario, this number. We just really couldn't come to any consensus. So we're going to have another conversation tomorrow. We asked them all just to think about it last week, and we'll just see if we're a little closer in being able to give some, because the idea was benchmarks to loosen things up and then the ability to back things back up if necessary. And that's a tough standard to establish, but we're trying to rely on the health department and the hospital to really guide that. Well, it just seems like we're making decisions in the dark already. Like David was just saying, we don't know whether the ordinances we have in place are the cause of us having low rates of transmission, or if it's some other reason. And so tonight, we're looking at putting restrictions out there or keeping restrictions in place. Again, with no real benchmarks, we're just saying willy-nilly. It almost seems like, well, I think this sounds right. I think that, we should require face masks for service employees without really knowing whether or not it's going to have any significant impact, or whether or not it's even necessary. Maybe transmission rate will never come to Rolla. I think you're right, Mayor. I think it will eventually, but when that happens, that's when we need to be taking action.
Good points, complex problem. A lot of people around the world are trying to get those answers. But as I said, those benchmarks are not going to be easy to reach consensus on. But we'll take a stab and let you guys chew on it.
Thank you.
Lister?
Representing Ward 3, I've heard from a lot of the individuals in our ward, and just like everyone else, concerns about work, concerns about personal health, and I guess the deciding factor for me is that what would make me vote against, most of the people I've heard from is opposite from what you did. I heard from most people saying they would like to remove all the restrictions, which is why I voted that way at the last meeting. And I still hold that line, and I say what would make me vote opposite if I had information that the public did not have, or if I had insight, or if I had a moral clause inside me that made me vote. And so I'm still towards just opening up completely again.
Ann, I passed you up. Any questions or comments?
Just with it's confusing with so many people that aren't complying with just wearing masks, and then it's hard to know. Maybe we could just have everybody wear a mask.
No thanks.
Do a new ordinance. I don't know, I'm lost.
Christine?
Well, in regards to some of the things that Dave said, you know, and about the bars, and I think John too, and loosening those 6-foot guidelines. You know, some of the, if you look at where other places that are having large amounts and using them not as a benchmark but as a study, you know, there seem to be having a lot of people who are getting ill from going to bars. And yeah, part of it is they're not observing that 6-foot benchmark or distance. And, you know, here in Missouri, again, looking at anecdotal records, we had those 2 positive hairdressers down in Springfield wearing masks, their customers wearing masks, and nobody got sick. So I'm thinking that the closer our ordinance matches those explicitly CDC guidelines, I think that's going to be more helpful. From just observation around town, I don't think we're going to get the non-mask wearers to be wearing masks unless we have ginormous numbers. And I hope that doesn't come to pass. I really don't. And as far as I agree with you as far as the, you know, setting some benchmarks and so on. I think it needs to happen. I said that last week. But I think it's going to be hard to choose those numbers because you'd have to be very specific, like you said. You know, is it 5 active cases? Is it 10 active cases? You know, and some people get well rather quickly, and other people, it lingers on for 65 days. So, you know, and obviously those people aren't going out. We hope they're not. But just looking at the, from the Phelps Mary's Health Department, just before the meeting, saying that they did the contact tracing, and this person had been to Walmart, no mask. This person had been here, no mask. Feeling symptoms, you know. To me, if you're feeling symptoms, stay back home. But, you know, at the minimum, wear a mask. You know, just show that you care for your community and the people around you. So I'm very, you know, I wish there was something we could do for those smaller businesses. I think opening up sidewalk tables would be a great option for them. But at some point, we can't mandate that for them. But, you know, maybe thinking out, having, and I hate to say, but small businesses, it's time to think outside the box, because this is not going away next week. If it was, it'd be an easier decision. It's not going away next month. This is here for the long term.
Thank you. Jody?
So I've been back and forth and back and forth and back and forth all week. I think all of us who are here are wanting the same thing. We want to protect the economic and social health of our citizens and of our community. And so at some point we're trying to find a balance between personal responsibility and whatever regulation is needed to help protect the public health and keep people safe. I was okay with the ordinance as it has been drafted. Listening to the comments about the small businesses and understanding that some of those places are so small that the 6 foot is a real burden on them. But I think I'm at the spot where rather than attempting to lower that, I would rather say that we're going to keep all of the recommendations that our businesses, our organizations comply with the CDC guidelines, whatever those might be. And so to Lance's point, if there's some way that we can offer up this ordinance as recommendations, keeping the parts that are the emergency declaration and perhaps the city's requirement for the health plan if city employees are or city property is involved. I think I would rather be there than trying to craft something that would be sort of arbitrary in terms of what distance we're going to keep. CDC is pretty clear. All of their stuff says 6 foot. That seems to be a pretty constant recommendation from them. And so I think we should not go less than the CDC guidelines. So, and as John said, what we're looking at in this ordinance is going to primarily unenforceable guidelines rather than strict requirements. And so perhaps we're at that point where having the information in front of the public is just as valuable as making it a requirement.
There are a few things in here that are
Right.
enforceable, like the mask on servers, things like that, largely unenforceable. John?
I think I'm agreeing with Jody on a lot of what she said. I think, if I'm correct in saying that you believe these should be guidelines, and we leave this to the restaurant owners to follow the guidelines recommended by the CDC.
I'd rather have them be
Right.
requirements, but I'm not sure we're there.
And I think if, at that point, it's, a lot of it is on the business owner to provide a safe environment for their customer. And if I walk in and I don't feel comfortable, I'm going to turn around and leave. And to me, that's part of what I think the public is wanting. They want to have that opportunity, I guess, to dive right in the middle of it or turn around and walk away, but it's their choice. But I do think that we've got responsible business and restaurant owners, because they are, they do have to follow health department requirements. So they understand what's necessary to be safe. So I'm comfortable with making these recommendations. Honestly, I think as we see our numbers go up a little bit, and we do believe we've got students coming to town, I think having something on the books isn't a bad thing that we can always turn back to. But I would like to see us make these recommendations.
What about nursing homes? John, I was looking for that clause in here. What are we proposing on nursing homes? Long-term care facilities?
Yeah, it's under 3.02, subsection D. It says they should follow their DHSS guidelines.
And is that an enforceable clause? The way we have it written?
No.
It wouldn't be enforceable by us, but it would certainly be enforceable by DHSS.
Okay. Because on that, when you talk about long-care facilities and nursing homes, scientifically, those are vulnerable locations. Unlike restaurants, those people can't vote with their feet. They're in there. So you might want to just be mindful of long-term facilities. Carolyn?
I agree a lot with what John was saying and some of Jody. guidelines, and the issue is, even the 6 foot, okay, if you have this as a guideline, CDC, if people don't want to follow that, businesses, are they going to be punished, reprimanded, called out, anything? Or is it really going to be up to what they want to do anyway?
To date, we have not taken any action against anybody.
Right. But in the future, are they looking at, do they have to keep in mind that, okay, the guideline, we choose not to do this, we're going to do what we want to do? Is somebody going to come down on them hard?
If anybody comes down on it, it's the consumer.
What about the health department? Does the health department, which regulates restaurants, are they looking at CDC guidelines and then
My
going in?
understanding is she follows the governor's lead, so if the governor had a reference to CDC or Health and Human Services, whatever, and since we delegate enforcement inspection to her, anything our ordinances, she would be following within the city limits. So if the ordinance is written as a guideline, that's how she will approach it. If you have it as a requirement, that's how she will enforce it.
And on the benchmark thing, pick a number. This is for Phelps County, right?
No.
Not just Rolla.
Just Rolla.
Just Rolla. Okay.
But the reality of it is, those benchmarks will have to be a broader area. If one of the metrics you decide is admissions to Phelps Health or deaths at Phelps Health, are we going to sit there and call them up and say, hey, was this person on a ventilator? Were they a city resident or not? You're not going to be able to do that. So these metrics are going to have to be rather broad. There are other nuances, and when we say we have a case in Phelps County, was that a case that was transmitted within Phelps County, or that was somebody that was over here and brought it back? I mean, the details of these benchmarks are they're deep. They're deep.
I still think that, again, our constituents are not stupid, and those who really want to focus on the safety, they're going to do all of it, the mask, the stay home, even if they're not sick, whatever they want to do. But I just don't think we should tell everybody what they can and cannot do, because they're not going to adhere to it anyway,
Right.
if they really
That's right.
want to.
That's right.
We've seen that. We've all seen that. And so one person worded it to me that this is socialism. We're becoming a communist state. Like, it's not that bad, but that's what they're comparing it to. And we've never run across anything like this, so nobody really knows. Oh, yeah.
Marie?
I'm not in any different place than I was when this whole thing started. I mean, if we're talking about 100% compliance as the goal, we're going to fail, obviously. But I'm not looking at this as all or nothing. I'm looking at this as more or less. And the more people that are following, we keep saying we're making decisions in the dark, but I don't think CDC guidelines represent decisions in the dark. They have said in the absence of treatment, in the absence of vaccine, the two things that are most important to reduce the transmission are distancing and masks. And obviously, we're not in a position to want to tell the average citizen that they have to do that, like they've done in some municipalities and some states, mandated mask wearing for every person in a public space. Obviously, that's not where we're at. But the more people in the more crowded places that are following these guidelines, the less likely we are to spread this in our community. So I am in the same place that I was. The more people that are doing it, the better. And I think the way we communicate this matters very much. If we say, it's a guideline, take it or leave it, whatever, we don't care what you do, I don't think that sends the right message. So I'm in favor of the ordinance as it is amended in our packet, with the exception of considering some accommodations for the very small square footage businesses. Open to having that discussion, but I would like to see it remain enforceable in the very limited capacity that it is in this packet. This represents a huge reduction in the restrictiveness of this ordinance, and I think that it strikes a good balance.
You, Deanna?
I would agree with Marie. Sorry. Those who have contacted me, for the vast majority, have agreed with Marie as well, saying that they want some form of restriction. Whether they themselves know what it is or not, they're wanting something. I also agree that it's smart to have safety plans in place for all those who are wanting to have an event of some kind. And I think it would be smart for businesses to put those safety plans in place for the public to see as well. In the event that we do rescind all of this, I personally do not want to, but if we do, I think businesses should have to be telling the public what they're doing or not doing, so that everyone's making an informed choice when they go out. But I do agree with Murray.
Yeah. I've been places elsewhere outside of Rolla that has those things
Yeah.
posted on there. It's helpful. So there's a couple of paths to go. Yes.
Rachel.
Oh, I'm sorry, Rachel.
Oh, sorry, I forgot that the meeting time was different today. So I'm been trying to listen here to sort of the different responses from my fellow colleagues to really understand sort of everyone's perspective. And like Jody, I really have been thinking about this pretty hard because, you know, there's a balancing here between sort of perhaps what certain people in the community are more comfortable with, you know, a little more openness, a little more risk, a little more personal responsibility, and some other people, many of whom have contacted me, who are really genuinely concerned about how this could spread in our community, especially, you know, knowing that my workplace is really thinking very, very hard and having to make very hard decisions about what we'll do in the fall when the students come back. I was comfortable passing the ordinance as is. The conversation, the hearing from Dave and hearing from John, that maybe we could allow some accommodations to the smaller businesses, sort of in deference to and in balancing the sort of economic concerns that we have in weighing this. I'm certainly open to those conversations. I agree with you, Lou, that I think we do have to think about the nursing homes, the in-care facilities, the large events. I think you're right that those are all concerns. I would prefer to lean on the side, like Marie, of leaving them as requirements rather than guidelines, just for the same reasons that the more that people follow these directives, the more people follow CDC recommendations, and the less that this is going to be an issue, and maybe the sooner we can all get to take these masks off.
Okay, thank you. So, just listening, it looks like we have two courses. We can keep the ordinance as presented with adjustments for the small restaurants or businesses, however you want to define those. Or the other path is to essentially change everything in here to a guideline. If we go down that path, we would like for you to keep in there the requirement for the safety plan, because we do feel we have an obligation to our first responders. Mm-hmm. If this thing turns south, those are the people that are going to be on the front lines, and those are the people who are going to suffer. Mm-hmm. So as an employer, I would ask you to at least keep that requirement in if you move everything else to a guideline. John, do you want to add anything to that?
Could I make a motion before we decide? Obviously, it sounds like we're going to go one way or the other on this. Could we make a motion that if for some reason we do end up keeping it as is, to amend to at least what we talked about, then we could make the second choice being whether we keep it or not. But we could at least amend that if it ends up being kept to the thing we talked about with a certain number of people, and I guess it would be more like a restaurant type business. Is that right, John, from what you were
You're thinking,
Well,
so Dave, you're thinking.
Let me jump in for an answer to the question. I think the way that this has to work is you make a motion to make whatever amendment you want.
That's right.
And then if it's passed, it will be as amended.
Of course.
And if there are no amendments that pass, you'll vote for it as is.
Sure.
Does that answer your question?
Yeah, the question I was asking John was actually, just as a group, if we did go forward with keeping this, we might not, it might get scrapped, it sounds like, but if we did vote to keep, I would feel comfortable and better maybe making some sort of amendment for our small businesses. So before I made the amendment, I was just gonna check with John, the other folks who had mentioned that, what seems like the right number there? Is it a 30? Is it a, maybe 30 because they could do outside seating as well? That could bring them to 40, for example, or
They want 100.
they 100? Yeah. Like I said, I mean, my focus on this is like, I've talked to some of the small businesses, and I mean, if you're 100, that's getting toward the bigger side. I'm not saying there aren't small businesses that are 100. But
You mean seats?
Seats, because the 6-foot distancing happened to be the issue with some folks, like with the 6 foot, they can only hold 10 people in their dining room. If we could say, if your place of establishment is 30 or under seats, you don't need to.
Is seats, I guess I'll look at John and Chief, because ultimately you don't have to do this. Is seats the right metric? Or simply the right metric?
In bars, you have a lot of people standing, and that's kind of a seat. So occupancy, I guess, is the right terminology, what they're allowed to have. Because the seat, so they can be standing there, not counted as a chair.
So conflict is, we're saying there's no occupancy restriction, but on the other hand, we're saying 6 foot. So that's the conflict they're trying to resolve.
But that's specifically what the gentleman from American Taco said at our last meeting, is his table spacing is prohibited. It's his dine-in service that's suffering because he can only fit 2-3 tables in there because
Right.
they have to be 6 foot apart.
Right.
So if he could have tables closer together,
I think he's got more than 2 or 3 tables in there, but
the principle being the
that's no
same.
different than what I said. At the end of the day, the conflict is, we've taken off the restriction on the occupancy. So
Right.
now it's the 6 foot between tables.
Right. He's allowed to have 40 based on his occupancy, but he can only have 10 based on the 6 foot. So that's where that's where I'm trying to help solve people in that situation, other small saltwater and some of these others that might be, and I'm not sure how to word that, but.
Well, and I think the only way to address that is, at the suggestion of Carolyn, you have to shrink 6 feet from 6 feet to a number less than 6. And that's the only way that you're gonna be able to deal with both being 6 feet apart.
I mean, here's a question.
In a small place, you either have to have the distance be less, or you have to grow a building.
Right, so my question would be is if we say, if your occupancy is under 40, we are going to enforce the 6 foot on you, for example, even though it's still 6 foot. We recommend that when you can, if it's a busy lunchtime, for example. I'm just.
I'd like to start by making a motion, before we tackle that, that we make these recommendations. And then we keep the, what did you say, the public property?
Safety plan.
Safety precaution, or safety plan. So I'd like to make that motion.
Second.
Okay, let's think about how that's worded.
It would change all restrictions to guidelines with the exception of the safety plan for special events.
Okay. So let's check with staff, because they're ultimately the one that's going to have to live.
Just was sort of scanning it and looked for words where we have required, must, or shall. There's about a dozen of those references, and those would be revised into a may kind of language. I don't know if they all have to be individually voted to amend.
No, I think if we change the shalls to mays, that probably fixes everything.
It's almost all in 3.02. That's the section that really
Yeah.
gets into the areas of the businesses and the restrictions. Like, there's about a dozen of them. We could touch on, call them all out, or I don't know how to have that discussion, if you want to think about each of them.
It's too many to think of
And what does that do
individuals,
to
so I
the-
think we're still at a higher level here, 50,000 foot. So, the motion on the floor and seconded, I think Matthew seconded, okay, is essentially to amend the ordinance so that all requirements are now guidelines with the exception of the public first responder safety plans?
Now, I do have a question. On the nursing homes, when we say should follow, that's
That's a
that's a
guideline.
Okay, thank you.
And whether you take that out or not, when those DHSS guidelines come down, they're going to be required.
Right.
Whether you say so or not, they're going to be enforced by DHSS.
Yeah, they're under those regulations. Understood.
Is that true for in-home services, as under the subsection E there?
If it is as a guideline for DHSS, yes.
Okay.
That's what I'm saying.
Okay, there's a motion, and yes.
So what does that do to the emergency declaration? Does that need to be adjusted here, or
I think we want to keep that.
Yeah.
just making that clear?
Yeah.
I think when you say restrictions become guidelines, I think that leaves everything in place, just changing those restrictions to guidelines, correct?
That was my, yeah.
Okay, there's a motion.
Who needs a motion?
So the entire ordinance would still
Okay.
be there. It's just, there's no restriction. There's no,
Okay, roll call vote.
Lyons?
No.
Allen?
No.
Murphy?
No.
Bolin?
Yes.
Schneider?
No.
Florence?
Yes.
Bush?
Yes.
Higgins?
Yes.
Eberly?
Yes.
Crow?
Yes.
Schott?
No.
Reuter?
No.
6-6.
Yeah.
Six is- Mr. Mayor, I believe that's 6 to 6.
You know, I came here tonight determined to throw this in your lap. Good. Because I've had an unpleasant 4 weeks, and now you threw it back. Damn, you're good.
Remember what you said when you started this conversation?
Remember, you proposed it too.
I acted on your request. I did not propose this.
Want to take a recount?
I'm like a lot of you folks. I have a libertarian side, and I don't like people telling me what to do. I vote with my feet and my wallet. I'm not going to any restaurant that I don't feel is safe. I mean, that's just the way I feel. However, there's a lot of people out there that do feel on the other side of the coin. So this is not an easy decision. I prefer adjustments, and I would least like to push the ball down the road a little bit more to see what's happening. Missouri this weekend got a spike. We're getting a mini spike in Rolla. We have some community events coming up. I just think I would rather see us loosen it a wee bit more rather than opening it up. People are following guidelines. I mean, we can sit here and say 6 foot, 5 foot, 4 foot, and people aren't going to follow those. So I'm going to vote no. So,
Could I propose I think I may have a clear idea of the amendment I was thinking to propose on the seating. So I'd like to propose an amendment to the section relating to 3.02 and I don't know if it's a new letter we need, but basically my amendment would be not enforcing the 6-foot distancing on restaurants with less than a capacity of 50.
50 seats, or just, you're saying
The
that's,
capacity of the building, I guess, because isn't that what we're going on? That's what we got.
What if the restrictions
What about
don't
the
apply to the
employees
first
too,
50
David?
people?
You got employees that are there too.
Is the maximum number in the room for the employees?
The governor's executive order in the past has not included the employees. The occupancy that they are given when they open the door for a business license does include employees. So the total number of people under the city of Rolla occupancy does include employees.
But these,
In short, your motion needs to declare whether it's counting the number of employees or not.
I'm going to say counting employees, because these are small businesses, and I'm not thinking they're going to have a ton of employees there. 50, including employees.
So the metric is the allowable occupancy, including employees of less than 50, and waiving the six-foot requirement between tables.
Suggesting it, but waiving it, our enforcement of it. We'd still like to suggest that people stay 6 foot, but we're,
Not waiving the enforcement. You can either make it a recommendation or you can make it a restriction. What you can't do is say that we're not going to enforce our ordinance.
okay, so what's the language need to be?
David, may I make a suggestion?
The
That-
first 50 people,
Yeah. That this ordinance does not apply to any business who has 50 people or less inside of it.
So it's starting to be reasonable.
that makes it easily calculable.
So you're not just limiting it to restaurants.
Right, any business, because it doesn't seem to make sense that,
And you could do that, but that covers then all the personal care, which are all very small businesses. But if you want to just stay with the idea that David was looking at, it would be in section 3.02A subsection D, where it says tables must be arranged to maintain a minimum spacing of 6 foot from any other table if no physical barrier exists, except in, this is the additional language, except in cases of businesses with an occupancy limit of less than 50, including employees.
So moved.
We'll see.
Thank you, Josh.
Okay, so is there a second to that motion?
I'll second that.
Motion made and second, roll call
Who
vote.
seconded? And who was the motion?
David?
David, okay. Ready?
Yes.
Mush,
Yes.
Schott,
Yes.
Reuter,
Yes.
Schneider,
Yes.
Allen,
Yes.
Murphy,
Yes.
Lyons,
Yes.
Crow,
Yes.
Florence,
Yes.
Higgins,
Yes.
Eberly,
Yes.
Boland,
Yes.
12 ayes.
Any other suggested changes?
We had earlier talked about businesses potentially putting their safety plan up outside as well.
Sorry.
We had earlier talked about businesses also putting their safety plan up outside as well for the public to see. So now that we've just passed that businesses with 50 or fewer people inside can do whatever they'd like, could they also put their safety plan up for the public to see? You had said earlier you'd seen it in other places.
I've seen it both. Sometimes it was bare bones, it was just on one page. Sometimes what I saw was a little note, kind of like an elevator. If you're interested in our safety plan, see the manager or something like that.
Okay, just something like that, just so people know kind of what they're going into before they walk in, just in case. But I could see it saying, speak to the manager as well.
Okay. Are you interested in details of that plan, or you're just saying to the restaurant owner or businesses? What are you thinking?
I would say businesses in general should be putting their safety plan forward, just because we know first responders, if they have to show up there, we need to know what's going on there as well as event planning. So for small businesses to put forward their safety plan, it could be helpful for the public to know how that small business is carrying forward.
So a method would be posting it. Another method would be that there's a little sign that says it's accessible upon request.
Okay. Just something to think about there. Because the people who have contacted me, a lot of the time, they want some form of a restriction, and they want to know what it is when they're going, so that they can prepare.
Calories are in everything.
Yeah,
I don't think
exactly.
this is- John, how would we do that? You'll have to come back in the form of a motion in a second, but.
Not to beat on that same section, but it sounds like on the section we just amended, 3.02A subsection D, where we granted this exception for a higher occupancy than otherwise would be permitted. That might be the example you would state in their provision, that if they are fall under this exemption, they're required to post notice. That, the idea is that it would seem awkward to walk into a restaurant or a bar and find out that you didn't like something and you had to turn around and walk back out. Where, maybe in that case, if you're going to fall under the exception, they have it posted.
I think that's a good idea, yeah.
That would be in that section as well. Something to the effect in that same section.
Posted health plan or accessible upon request?
I would say posted, so people know what they're getting into.
And it might just be that they're just posting the exception to the occupancy rule.
That's not what Deanna's talking about.
I'm
Deanna's
talking about like,
safety plan.
yeah, I'm talking about like an actual safety plan. So like recently, the Juneteenth event that took place, there was a safety plan for it, even though it wasn't an event needed where first responders were needed. We still put one forward. So something like that, could businesses put their safety plan forward for the public to see, just so that now that we're giving this exception, we're also giving the public the opportunity to see how the business has chosen to respond on their own.
And they're only doing that once,
Yes,
right?
just
They don't have to do it
once.
every day. It's
No,
like you do
just
once and
post
it's
it
there, right?
once, yeah.
Oh, I got you. So not posted on the front of the business necessarily,
That was a suggestion, maybe have those folks posted on the front of the business.
What if they don't have a safety plan?
When you say once, maybe I'm misunderstanding. I'm thinking.
I think we're on the
is-
same page.
Okay,
I think we're on the same page.
okay. So the safety plan, health plan would be posted for those businesses that were covered under this other exemption. Is that what we're saying?
Yes.
Would you like to make that as a motion?
Do I say all that again, or do I just say yes now?
So moved.
Yes?
Yes, yes, okay.
Is there a second?
So moved, works.
All right, I don't know this yet.
Second.
Is there a second? Okay, roll call vote. Let me just, hold on 1 second, hold 1 second. Again, I'm gonna look at the people in the front lines that have to.
Yes, good. Yeah.
If I'm hearing it correct, they're asking to place their safety plan on whether they're 6-foot distancing and outdoor masks. If they're under 50 occupancy, they have to post that or provide it. They have to post it or provide it, or give it to us, or
Not give it to you, but post it for the consumer that's going into that
Yes.
restaurant. They can look on the front door and say, I want to enter, I don't. The question is in the details,
Yeah.
how detailed do we want this?
so what rules?
I wouldn't say there'd be rules, I'd just say it's for the business to put out to the public to say. So for example, I think we had ours that people wore masks when handling food, gloves when handling food, sanitizing. Yeah.
You're willing to leave it to the restaurant, their discretion as to what they put in that plan?
I think it's up to the business, yes, it's their choice. I just think we need to give the public the choice to see that too before going in. Because like you said, it could be awkward going in.
I'm trying to
Yeah.
differentiate between discretion. If it's not their discretion, then we're going to come up with all this stuff.
I think it should be at the business's discretion.
Okay, okay, there's a motion and second, roll call vote.
Florence,
No.
Crow,
No.
Murphy,
No.
Shaw,
Yes.
Schneider,
Yes.
Reuter,
Yes.
Allen,
Yes.
Higgins,
No.
Eberly,
Yes.
Lyons,
Yes.
Bolin,
No.
Mush,
No.
6.
I'm sorry.
I think this is rigged, so he gets to pull it off.
I'm going to vote no, and I'm going to leave it up to the restaurant owners, because quite frankly, I think restaurant owners that are smart are going to look at the leeway that you're given tonight and figure a way on how to get us back in those restaurants, starting with me. So the smart ones will figure it out, smart ones will post those, and they'll get the business. Any other changes?
No. Oh, I'm asking for a point of clarity on how we do business, so it's a little different than what we're going on now. I can wait to the end and ask about that.
I'm sorry, that's right.
I'm asking for a point of clarity on motions and how we set them and when we open them up for discussion, so that can wait till we're done. I'm just trying to educate myself on, it's a little different than the bodies that I've been around, so typically it's moved to second, then it's open for discussion, and then we talk about, well, we don't open it up for discussion and then call for questions or anything. It's just, it's moved to second and then they vote upon it?
There should have been a point for, I should have circled back and asked you for questions or discussion.
Okay,
after
I
it was
just,
made. So
okay,
that was an oversight on my part.
okay.
I would make a motion that we pass this with the amendments that we've had.
Say that again?
I'd make a motion that we go forward with these changes and the amendments that we've
So
put
what
in.
we'll have to do is we'll have to have a first reading of what's been published, then come back
And add those amendments.
and add those amendments, and then ask you to approve the amended ordinance.
I think what Mr. Schott is asking now is that he's wanting to call the question as to pass the ordinance as it currently states.
Right. Any other comments?
No, as it, he doesn't want any additional amendments to be considered.
Just ready to move
It's
forward.
ready to move.
Yeah.
Is there a second to that?
Second.
Okay, roll call. vote.
Murray, was that Murray?
Yes.
Hold on. Discussion.
Discussion. Sorry.
Good job.
Sorry, I don't always catch it.
Any discussion on the motion and the second?
We will.
So the motion on the floor is that we,
Basically cut off debate. That's what the motion
Ready
is.
to vote on it unless other people have changes, I guess.
Right.
okay. All right, so this, it's just gonna be the first reading of it, is what you're saying.
I'm sorry?
Go ahead.
Yeah. So the question is, in this discussion period, if anyone thinks that they want to make more adjustments, then say so right now.
Gotcha.
Okay, roll call vote.
Higgins,
Yes.
Bolin,
Yes.
Reuter,
Yes.
Schneider,
Yes,
Allen,
Yes.
Murphy,
Yes,
Lyons,
Yes.
Crow.
No.
Mush,
No.
Florence,
Yes.
Eberly,
Yes.
Schott,
Yes.
10 ayes and 2 nays.
Okay?
10-2.
Okay, can we have the first reading of the ordinance that was posted for this evening?
If I can read it, yes. An ordinance amending ordinance number 4565 in the city of Rolla, Missouri, allowing all businesses to operate within the city of Rolla with proper safeguards.
Is there a motion to suspend the rules and have the second reading tonight?
I'll make a motion.
Second.
Motion made and second. Roll call vote.
I have a question. You're saying as posted, but we made an amendment,
We're
right?
going to come back.
We will do that before the second reading.
Okay, gotcha.
Are you ready?
Yes.
Okay. Allen,
Yes.
Lyons,
Yes.
Murphy, Murphy,
She said yes. She keeps pushing.
yes, is that a yes?
yes,
Thank you. Bolin,
Yes.
Schneider,
yes,
Reuter,
Yes.
Mush,
No.
Florence,
Yes.
Eberly,
Yes.
Crow,
Yes.
Schott,
Yes.
Higgins,
Yes.
11 ayes and 1 nay.
Second reading.
As amended, an ordinance amending ordinance number 4565 in the city of Rolla, Missouri, allowing all businesses to operate within the city of Rolla with proper safeguards.
Is there a motion?
So moved.
Second?
Was that Marie?
To approve, right?
Who's second?
Second.
Was that Jody?
Yes.
Thank you.
Any questions or discussions? Roll call vote.
Just as.
Oh, I'm sorry. Ann or Christine? Roll call vote.
Crow,
No.
Schott,
Yes.
Reuter,
Yes?
Schneider,
Yes,
Higgins,
Yes.
Murphy,
Yes,
Yes.
Lyons, Boland,
Yes.
Mush,
Yes.
Florence,
Yes.
Everly,
Yes.
Allen,
Yes.
11 ayes and 1 nay.
Ordinance is approved. That's all we had on the schedule tonight, so
We have special meetings, we don't have prayer and religion. Pledge allegiance.
Typically not.
Huh.